I wanted to welcome everybody to the inaugural Global Health Security Seminar Series, which is brought to you by the Georgetown Center for Global Health Science and Security in partnership with the Georgetown Global Health Initiative, which is sponsored by the President's Office. We're hoping that this will be a monthly event, and we're anxious to get your feedback. I know this is early, but our hope was Friday mornings you can get a parking spot on the street. So
we did it. Yeah, it's true.
Get a spot, then go off to work. And for the students, I'm sorry. But we're hoping to do this on a monthly basis. We've actually the next one is already scheduled for this room on October 13th, and we have Ambassador Jimmy Polker who will be speaking about some of the health diplomacy aspects of both the Zika and the Ebola response. So let me get started. Beth is reading over my shoulder on the notes that I made to
I'm not reading over your shoulder here.
Well, I am delighted to introduce our first speaker, which is Dr. Beth Cameron. And oh gosh, she's been working on issues related to health security for about 15 years, moving initially from work in cancer research and through the AAAS program entered government, where she was on the Hill and eventually ended up at Department of State, where she worked on global threat reduction issues, and at one point led the biological engagement program at State before moving to Department of Defense to work with Andy Weber, and then in 2013 moved to the White House, where in her position at the National Security Council, Dr. Cameron basically single-handedly made the global health security agenda happen, and has been a driving force in advancing global health security around the world and in the United States, and has recently joined the NGO community as the Senior Director for Global Biological Policy and Programs at the Nuclear Threat Initiative. She is also, I'd like to note, an affiliate of our Center of Global Health Science and Security, which I'm sure goes on the top of the resume.
I'm excited about it.
But really, really delighted to have Beth here with us today, and I will turn it over to you. So thank you.
Thank you. Thank you, Rebecca, and it is absolutely a huge pleasure to be able to put that on my resume, and just to give credit where credit is due, because Rebecca is, as usual, way too modest. She was greatly involved, as was Julie and your center, in informing the global health security agenda literally from before it was born. So you deserve some great intellectual credit for the work that went into it. The great thing about being at the White House is we can take everybody's ideas and then throw them up and hope that we have support for them. But the real support for GHSA came from President Obama, Ambassador Rice, and others, and so we were lucky to be able to get those ideas up to them. But the point of that is to say that the academic community, hey Ed, the academic community has a huge role to play in these efforts, and if you are doing the kind of work that the center here at Georgetown is doing to create data, to create a background information, to create a push, you can really influence change. And so I want to, especially for students who are looking at this or people thinking about the academic community and how it can influence policy, absolutely 100% influenced everything that I did on GHSA and every other issue at the White House. So thank you for that. I'm now at the Nuclear Threat Initiative. So what is the Nuclear Threat Initiative doing on biological threats? We were formed by former Senator Sam Nunn and philanthropist Ted Turner to look at combating weapons of mass destruction and disruption. And bio threats were always on our agenda from the very beginning. And Peggy Hamburg was actually the first person in the position that I'm in now at NTI before she went on to be the FDA commissioner under President Obama. So I'm filling some huge shoes there at NTI as well, and really delighted to be doing it. So today I'm going to talk for about two main issues, and I'll talk about what those are in a minute, but I want to also say I know we are recording this, and so if folks have questions along the way, feel free to jump in, but I'm going to repeat your questions so that everybody who watches it later in the student community can hear it. But please, if I use an acronym that you don't understand, if I jump through something that doesn't make sense, feel free to jump in so we can make it conversational. And I'll try to stay on time so that we have some time for questions at the end as well. I've also tried to make my talk picture rich so that if there's something that jumps out at you and doesn't make sense. In full disclosure, many of the pictures are intended to have a metaphor. Some of them are just pretty pictures, so that's my disclosure on that. Oops. Here we go. I'm going to use the keyboard. So I'm going to talk about global health security. I'm going to talk about the next steps, from my opinion, but also informed by many people in this room and in the academic and governmental community about what I think we should do next on global health security as the agenda is sort of in its middle to end of the first 5-year lifespan. But I'm also going to talk a little bit about one specific aspect of global health security that we're focused on at NTI and that I've spent a lot of time on in my career and people like Ed have spent their careers on. I'm going to talk a little bit about biological risk, biosecurity, and dual use aspects and why we should be, in my opinion, focusing on that piece of the agenda as well as the others. And so I'm going to just summarize by the 2 quotes that are up here. The US government remains strongly supportive of GHSA, and that's a really good opportunity to focus on something that's fairly bipartisan in nature. But I also want to draw your attention to this quote from Bill Gates from the Munich Security Conference this year, where he says, famously, the next epidemic could originate on the computer screen of a terrorist intent on using genetic engineering to create a synthetic version of the smallpox virus. That's a little bit of a provocative thought. Put it in the back of your head. I'll come back to it in a little while. So I'm going to talk about why the US leadership remains essential. I'm going to talk about what's next for global health security agenda, and I'm going to talk about some potential for new opportunities in biosecurity. So this is my why should we care about biological risk slide, and I think most people in this audience are fully bought into this, but disease threats know no borders. It doesn't matter if they're naturally occurring, if they're deliberate, or if they're accidental. They have the potential to kill thousands of people, cost billions, and lead to political collapse. And that's my doom and gloom quote for the day. I think all of these things are absolutely true, but I want to draw your attention to the political collapse piece. There were many terrible things that happened during the Ebola outbreak in West Africa, including the cost of over 11,000 lives. One of the things that did not happen is we did not have political collapse of those 3 countries. And we were lucky that those 3 countries had fairly strong leadership, that they worked well together, that they worked well with the international community, that the United States government, which was willing to jump in with a lot of funding and time and people, had good relations with those 3 countries. Those were a lot of factors that weren't necessarily a fait accompli, definitely weren't a fait accompli. And we were worried that at some point, one or more of those countries could actually have a much larger problem in a neighborhood that's not so great. Boko Haram is not far away from those 3 countries. So that's another reason to be thinking about biosecurity and bioterrorism, and also the relationship between weak health systems and political instability in general as a national security issue more broadly. Risk is obviously magnified by global travel and trade, terrorist interest in WMD, and urbanization, people living in more urban communities, land use changes. We were at an event yesterday sponsored by the EcoHealth Alliance in New York on global health security. They're very interested in this issue and how it affects zoonotic disease spread. Escalating tensions in unstable regions enhance the likelihood that a cross-border bio event could result in a catastrophic outcome. And then rapidly accelerating peaceful applications of biotechnology obviously hold huge promise for how we can better counter biological threats. But obviously the same technologies could be deployed to create biological weapons. I'm going to come back to that issue at the end, and I'm going to focus most of my talk on these two points. So just at the top, I want to say the health and the security communities have one major shared goal, which is we all want to stop outbreaks at the source. So we want to stop them before they spread and become epidemics. We're probably not going to stop outbreaks from happening, but stopping them from becoming an epidemic is what we want to do. So I'm going to talk for just a minute about global health security and the global health security agenda. How many of you in the room are familiar with this? Okay, good. Most people. So I won't do the long version. I'll do the slightly shorter version. So the purpose of the Global Health Security Agenda was to get a shared vision and some shared common metrics for how the world could come together to attain a world safe and secure from global health threats posed by infectious diseases. And it always factored in from the very beginning whether naturally occurring, deliberate, or accidental. And that was really purposeful. Within the US government, we wanted to create a community, and some of you in the audience were part of that community at various points in history. We wanted to create a community where the health aspects of global health security and the more security aspects were considered together in every aspect of our planning. And so I'm going to talk a little bit later about our appropriations structure. I see Josh from Kaiser here, who spent some time actually looking through our appropriations for global health security, which is enormously helpful, by the way. They're spread all over the US government, and that's really challenging if we want to actually show what we're doing to build true capability in countries to implement the international health regulations, which really underpin everything that we're trying to achieve with the Global Health Security Agenda. So it was launched in February of 2014, and one of the major drivers for this launch was to be able to ask countries to make concrete commitments, to do something themselves on a national basis, to do something regionally, or to work in a global context, and to make something very concrete and then be able to come back in September at a summit that President Obama hosted to announce what they were going to do. And this was a very successful strategy. We were able to get 44 countries and international organizations on top of that to the table that year. One of the things, though, and I'll come back to this, and it's a place where the academic community can be incredibly helpful, is tracking those commitments, looking at accountability, and looking at how we can continue the momentum to continue to make and keep large commitments. So we also launched GHSA to get some branding in place. So prevent, detect, respond. That's the way that many people who are learning about global health security think about it now. That's the way the WHO currently talks about global health security. That is definitely not the way that we were talking about global health security before 2013 and 2014. We were all talking about it throughout the health and the security communities. We were talking about it in the biosecurity context. We were talking about it in the dual-use research context. We were talking about it as implementing the international health regulations. But when we started briefing leadership within the White House and the federal government, everyone understood intellectually that the international health regulations are vital. But briefing other leaders and trying to get it on a head of state agenda as the international health regulations and why we need to implement them was a lot harder to explain. So we needed an elevator speech. And we needed an elevator speech that didn't dumb it down and also appealed to multiple communities, those who are looking at actually prevention, those who are looking at detection and surveillance, and those who are looking at rapid response. We also wanted to look at getting specific measurable targets. So before, and the ones that are coming up that are blue are prevention targets, the green are detection targets, and the purple, or magenta, are response targets. And the ones coming up now, just to highlight, since I'm going to spend some time talking about biosecurity later, are those that the security community is a little bit more focused on. But there's a lot of interplay across these targets between US government assistance and other country assistance. When we launched GHSA, all of the appropriations in the US government that were focused on helping countries build capacity towards one element on this slide, we're all saying in meetings that one of their core objectives was to help countries implement the international health regulations. That was a core mission for the Department of Defense Cooperative Bioengagement Program, and it was a core mission for the CDC. It was a core mission for USAID, for State Department, for everyone. But nobody was using the same metrics to show progress, often in the same countries where they were operating. And so this was a huge issue for us as a US government, as much as it was an issue for how the whole world could be measuring. And so we started with, could the US government agree on a set of targets? And then we were able to do that within about 6 to 8 months. And we were able to then take those targets and put them out to the world and say, this is what we've done, what do you think? Could we get agreement on this from a broader community? And over the course of about 1.5 years, we were able to get agreement on this set of targets which each have underpinning metrics underneath of them from a much larger community, which is now 59 countries, and then ultimately, just fast forwarding, these were adopted by the WHO as part of their strategy for external evaluation for the IHR. So this was a very successful strategy, but it started with what we were going to do ourselves in the US government to get more organized. And I think that that's a piece that isn't always discussed. And so this is just a quick snapshot of where we are. We have 59 partner countries, 11 targets, a steering group, some loose governance, and this was launched as a 5-year effort. And so the nominal sunset would be in 2019. I don't think that should happen. I think most people in this room don't think that should happen, but it's not done yet. The continuation of GHSA is not a fait accompli yet. So what have we actually achieved? So this is just a snapshot of different achievements that were put in place largely by the partners that are outlined here, but also with great partnership from WHO, FAO, and OIE, and others. So we were very successful in getting high-level attention to this issue. And this is a factor of two things. One, enormous care and feeding from the head of state in the United States, from President Obama, but also from other heads of state like Chancellor Merkel, who deeply care about this issue. And then Ebola obviously was a terrible thing, but it put this on the radar screen and really catapulted it into the G20 for the first time and into the G7 as health and security coming together for the first time. And it's really stayed on the G7 and the G20 agenda since that time in different iterations. We wanted to get multi-sectoral attention, and the word multi-sectoral is used a lot. What does it really mean? It means all of those different communities: health, security, defense. In our case, the Department of Interior, which has control of the national parks. It means FDA, it means CDC, it means NIH. It means coming together to actually talk about how we're all going to work, not just in coordination, but in synchronization towards the same target so that we can measure progress. I mentioned that we created and adopted the first ever global metrics for implementing the IHR, which are now integrated into the WHO's external evaluation process for that. The external evaluation process itself came out of the GHSA, and that was a stretch goal. Rebecca, myself, Scott Dow, who's now at Gates but was then at CDC, we had a number of conversations, and frankly, at least speaking for myself, did not think we would get here. This was a stretch goal we thought was not even remotely possible in 5 years. But we got there, and we got there through a lot of hard work from many of you and around the world, leaders like Finland who really took this on and ran with it. We've seen tangible improvements, actual improvements in the ability of countries to respond to real outbreaks as a result of assistance provided through GHSA. And this is a place where the academic and the governmental community, as we track these success stories, really important. We met with the Office of Management and Budget as part of a Global Health Council effort a couple of weeks ago, and they said it absolutely cannot be understated how important it is to be able to do that academic work to know how successful these programs have been so that they can make the case for additional funding. And then finally, mobilizing the private sector and next generation initiatives. This is a place where I think more work can and should be done. So we have the Global Health Security Agenda Private Sector Roundtable, which brings companies together around preparedness. We also have a next generation GHS network, and I see Joanne in the audience from a Georgetown alum who helped start this effort. And this is a place where getting that community more globalized and more focused on specific efforts in their own countries that can help achieve the GHSA objectives and targets, that's something that I know that many of us are incredibly interested in, and it's a place where if anybody in the audience is interested, this is online, readily available. Joanne knows how to find it. Raise your hand. Sorry to put you on the spot. She's the person to talk to, and there's a great website with information. So in terms of what should happen next, the low-hanging fruit is we should continue this effort, and I'll make the case for why. So first, GHSA is an opportunity to convene countries around this issue and to keep the same targets out there. Second, continuing to call for very specific commitments and then holding partners accountable. That doesn't happen on its own. A ministerial every year really does help with that. It also helps rally the non-governmental community around some specific milestones, and that's something in my new role that I'm very interested in. It raises attention on a regular basis to heads of state, if we're lucky, and at least ministers, if we're not, and that's a hard thing to get. So once you've got it, I would posit you don't want to lose it. Of course, you have to make this useful, so you don't just go to meetings to go to meetings. But if you can use the ramp up to these meetings to actually get concrete commitments implemented, host countries can really do a lot with that, especially ministries of health who are able to make a better case to their ministries of finance because they want to come to the table with something concretely done and delivered. But that takes work. And incentivizing commitment and accountability, I've talked about that a lot. I can't stress it enough. And then ultimately, we want to break the cycle of panic and neglect. And the pretty backdrop here is not just a pretty backdrop. It comes from a report that the World Bank helped to sponsor from an international working group that focused on pandemic preparedness financing. And one of their main goals was really to keep this issue on the radar screens of heads of state and to look at how do we get to sustainable financing. That's an unanswered question still for global health security, and I think it's the main question for the continuation of the GHSA that we really need to answer. So we also were successful, while we're talking about sort of success and next steps, in getting all of these different appropriation pots in the US government marching towards the same targets. They're different appropriations, so they have different reasons for existing. They are responsible to different committees. So we're not talking about telling these programs that they're all responsible to, to the White House or to a GHSA mission that's larger than themselves. But what they are now responsible for through an executive order put in place last year, which was kept in place by the Trump administration, they are responsible for actually coordinating amongst themselves towards these common targets and meeting on a regular basis to talk about who's going to do what on this initiative. And the reason for that is because global health security is a national security priority, and it should remain that way. And so getting that achieved and keeping it are very important objectives in my view. Our continued commitment as a United States community, not just the government, but everybody here who works on this issue, our commitment is important. When we work on something and we work on it for a long period of time, change tends to happen. We were able to leverage our commitment after the Ebola response, which was $1 billion to CDC and USAID for global health security. We were able to leverage the G7 to get a commitment to assist 76 countries and regions. That is a wonderful commitment, but it needs to be tracked and it needs to be crystallized. And that's something I know that the Georgetown Center here under Rebecca and Julie are looking at. How can we track that and measure over time? And so that's going to be an enormously helpful project. It's an academic project that is going to help enormously with diplomacy. And so I want to continue to make the point about those linkages because they're really important. The continuation of the external evaluations. So I mentioned that GHSA led to this JEE, no one calls it a G, do they? Process. I still call it JEE, but I'm waiting for it to turn into something else. The joint external evaluations started as an assessment process that was piloted by the Global Health Security Agenda Steering Group. More than 50 countries have now done that, and this is fantastic. There are national plans coming out of this process, there are milestones, there are governments bringing together different sectors all over the world. The WHO is really stepping up to the plate to monitor, to put online the external assessments come out of countries. 33 of them are published now, 34 are published. One is in Kyrgyz, and we weren't able to translate the scores, but there are 34 published online, and that is great. But that needs to continue. And if these are going to be done on an every 3 or 4 year basis, there needs to be something in place to actually keep pushing that along, or in my view, it's not likely to happen. And then continuing the momentum in the non-governmental community. So this is absolutely critical. And there's all these initiatives that have sprung up around GHSA, which actually talk to each other. We did a joint letter on extending the GHSA that included signatories from all of these elements. And I think that's really exciting. And one of the things I'm interested in doing in the non-governmental community, working with many of you, is to figure out what those specific things are that we can push for that will really help the champions in the governments to do more on this effort. So challenges. What are the challenges? We still don't have the appropriations we need. I think most people in this community completely understand that preparedness costs less than a response to a terrible outbreak. And it's not just the immediate response, it's the recovery. It's the long-standing geopolitical consequences of a major outbreak anywhere in the world. And making this case continually to leadership and administrations, Congress, and OMB, this is really important. And I think any additional help in making this case about cost is incredibly useful. Tracking and accountability. So I've mentioned this a couple times, but really concretely what this means is if a country has an external evaluation to figure out where their gaps are, they should develop a national plan for exactly how they should fill those gaps over what time frame. And ideally that national plan should have some host government funding. Even from countries that don't have a lot, a little bit of leverage goes a long way with donors. Financing. So this includes host countries, but it also includes all of those governments that are putting in money. It's a compact that if the country's going to create a national plan, that everybody should actually use it. And that's a challenge. It doesn't always happen that donors march to the same tune as those national plans that are put in place. And then political commitment to make and keep the commitments that are out there. And so this is, I think, in my opinion, the most important piece of what I would call GHSA 2.0. And then lastly, focusing on global health security, but recognizing there's a broader context here. So global health security in the middle as prevention, detection, and response is part of a much larger global health picture, a much larger national health picture in countries, and also a much larger risk environment for every country around the world. And this also translates into thinking about GHSA in the context of health system strengthening, in the context of universal health coverage. I spent a lot of time staffing our Sherpa in the White House on global health security issues, and it was really important in the context of Japan's G7 presidency, which was focused on universal health coverage, to be able to explain how global health security fits into that picture, why weak health systems need to be strengthened, why that's part of GHSA, why and how GHSA is connecting lab capacity programs through PEPFAR, through maternal and child health related programs, through the President's Malaria Initiative, and leveraging those different pots of funding towards a common target. So making this case that these are related and not cannibalizing each other when we use different taglines, that's really important. And I think figuring out how to talk to these communities in a way that says, we're not saying global health security is the most important thing, but it's a really important piece, and it needs to be there as one element of the broader health system. So that's another place where I think a lot more attention in the non-governmental community could be really helpful. And then, so what's next? This is just my wheel slide that puts everything that I just said in one pretty picture. But I do think that it's likely that the global health security agenda will be continued. I don't think that it's a fait accompli, though, so anybody who is interested in raising their voice on that as students in the non-governmental community, or those of you who are still in government, it's really important to do that and to do it now. I do think there are some detractors still out there who are worried that this is a parallel effort trying to compete with WHO, which it is not. But that is still an issue. And so the US government's supportive, the steering group's supportive, most of the countries that I've engaged with are supportive, but it's not done yet. So it's worth making that point to many of you that have opportunities to talk about this in other venues. So I'm going to switch gears and talk a little bit about the biosecurity piece and why I think we should focus a little bit more attention on that in GHSA 2.0. But it might be a good time to break for a couple of questions if anybody has a question about this piece before I jump forward. Any questions? It's still early, I know. Sure.
It's such a good story. What about the design, when you went into this thing, made it stick? Because there's a lot of speculation that with any change of administration, people get tired of this thing and it wouldn't stay. How did it happen that you got it to continue?
Through the Trump administration particularly?
Well, not necessarily.
Or just over the time?
Just in general, people
Yeah.
get tired of old initiatives. This one seems to have stuck.
Yeah, so there was a lot of things there were a confluence of several things. So the absolute most important thing was targets. And the reason that was so important, and a lot of people would say it was Ebola. But the targets and Ebola are linked, and I'll tell you how they were linked. when we had the opportunity to ask for to put in a request with OMB for some of the funding that came out of the emergency appropriation for Ebola, to make the case, if we're going to focus on the response and the recovery, we also need to be focused on the future so this doesn't happen again. That was a case that resonated with a lot of people in the White House, but what made the decision to get that funding was that we already had an effort with specific targets that OMB could go to Congress and say, we are actually going to work to achieve these 11 concrete goals in these 17 countries. We're going to have work plans, we're going to have metrics that the president asked for, as well as OMB. And so being able to say how we were going to measure success very concretely, and that we had, at the time, over 50 countries interested, that was the most important factor. Transitioning it into the Trump administration, it was also really important to be able to say that the rest of the world had made a large commitment to help leverage our funding through the G7, and the fact that we'd already put so much funding on the table and so much work was a huge factor. There's also some champions of biodefense in the White House right now who have been around a couple of different tours and different administrations. We have Tim Ziemer, who is serving in the position I was in when I left. He's a big champion of global health security. And Tom Bossert, the Homeland Security Advisor, was focused on biodefense in his last tour in the White House under President Bush. So there was a confluence of people who sort of got this, but the being able to show the measurement and evaluation was the number one factor. And that was informed by a lot of people in this room, including the center here at Georgetown hosting this event. So thank you. It was good advice. We took it. Any other questions?
You mentioned parallel kind of priorities. To what extent would this overlap with the UN's agenda for sustainable development? Because I know they have a number of health goals involved there.
It's a great question. So we had a number of conversations about that. Another thing that was vital to the success of this within the White House, but also I think in the larger community, is that it was co-led by the piece of the National Security Council focusing on countering biological threats as a WMD issue, where I and Laura Holgate were, with the part of the White House focused on democracy and development, so Gail Smith. And so bringing those two communities together as the Sustainable Development Goals were being negotiated was important, because we always had in our heads, how is this going to fit in with the SDGs? That was also really important for support from countries like Finland that have an approach of health in all policies. They were very involved in the SDGs, on the health goals and the SDGs. And along the way, at various points, there have been resolutions and pieces of language built in to get the IHR, hung off of those Sustainable Development Goals in a meaningful way. And so I think having an effort to show measurable progress, and more importantly, the external assessments to show how countries are getting prepared, that was really critical. And so I see it as a critical piece of the SDGs and as of the overall health system. Rebecca, did you want to jump in?
I have a question.
Sure.
And I think we are seeing drastic cuts in funding to implementing agencies. And I think, I'm thinking about the slide that you had up, how the U.S. investments have been leveraged. What do you think happens when the money goes away?
When the U.S. money.
How much of this momentum can keep going if the U.S. isn't putting $1 billion towards capacity building?
Yeah, so that's the 64, well, it's the billion-dollar question, actually. So I think the GHSA effort will continue regardless at this point, unless countries really come out and actively advocate against it, which I doubt will happen. The joint external evaluations will continue as long as countries see some financial incentive for doing a second one. So I think the countries that want to do it will do a first one. So if we're lucky, maybe we'll get half of countries, or maybe a little more, to do a first external evaluation. But I do think the financial incentive is important, and so I think unless an external donor comes forward with a pot of money as a match for countries that put some funding into their national plans, I think it's going to be really hard to keep the momentum in the countries to make this a sustainable process So yeah, I think it's challenging, and so one of the things we're advocating for within the GHSA consortium, within the Global Health Council, is a sustained appropriation for this, particularly at CDC.
Where do you think
I think that it is possible that there will be more, if the US government actually says no and continues to cut the budgets that fit into this, or continues to propose cuts, which hopefully Congress will not take entirely, that there will be more focus from philanthropy on this. That is my hope, but it is a hope. I mean, I think it's a really, really great initiative that Tom Frieden announced a couple of days ago with a significant chunk of funding that's focused on cardiovascular disease as well as global health security. But that's not nearly enough funding to get this to keep going. And what I'm most worried about, frankly, is the people power. So we have people deployed all over the world who are acting as the glue for this whole effort, who are training people, who are helping to make connections in country. As CDC calls them, our deployed disease detectives. They're part of our biodefense, and I think we need to make that case to this administration and make it loudly. All right, I'm going to move on to my second topic, but hopefully we'll have time to come back at the end. I'll be a little bit quick. Whoops, I'm going to keep doing this. Okay, so I'm going to talk for a couple of minutes about biosecurity as a piece of the global health security agenda, and why I think it's worthy of the amount of attention that we did put into it, and B, why it's worthy of continued thought. And then C, I'm going to talk a little bit about one piece of that, which is how advances in technology are impacting biological risk, which is a topic near and dear to many of you, and we have some serious experts in the room who've spent their careers on that topic, including Peggy Hamburg, who I saw slide in the room, and Ed Yu, who is doing huge work at FBI on this. So biosecurity is vital, but it's underrepresented in the GHSA community, and at least it's there. I mean, that was a huge lift to get it in and keep it in. And those of you that have known me a long time know it was a personal passion of mine to keep it in the JEE, and we were successful. But this is a total swag number, by the way, so those of you who are academic, especially Josh, do not quote me on this number. But this is probably not a totally off swag. The annual biosecurity budget, and that's the world, every country funding biosecurity to assist another country, so the assistance budget for biosecurity is probably only about $300 million a year. And most of that is the US, and I think 2/3 it's probably more like 3/4. So it's not a lot when you look at everything else that goes into national defense, national security, and it's almost all the United States. It's being slashed. The DoD budget in particular has gone, in my work on this topic, from $300 million down to $174. That still sounds a lot for the non-governmental community and the public health community, but given what that money buys, it's really budget dust at DoD, and that's another advocacy point worth continuing to make. I made this point earlier. Pathogens are becoming more accessible. I'm going to talk a little bit more about what this might mean for the international discussion around health security. They can be created, they can be modified, the technology is democratizing, the data is out there. And there's no dedicated biosecurity dialogue to talk about how are we going to build commitments in this area. There's lots of great forums, and we can use those forums, the Global Partnership Against the Spread of Weapons and Materials of Mass Destruction, the Global Health Security Agenda, the BWC, but there's not really a dedicated effort that's focused on, okay, no, really, how are we going to build commitments? We have some great work happening in countries outside of the US, but it needs to be continued. How can we help Denmark and the Netherlands, who are making commitments in this area for the first time, how can we help them make the case to their own governments? And they're using the JEE to make that case. The Netherlands actually got more money from their government because they were able to show that Uganda improved in biosecurity scores based on, from their GHSA assessment to their actual full joint external evaluation. How can we use that kind of momentum to get more concrete commitments in this area? So we know that 33 countries have published a joint external evaluation, and I said earlier 34. One of them is in Kyrgyz, so I don't want to diss my Kyrgyz colleagues. We weren't able to decipher that one, so I did not include it because I didn't want to get it wrong. And I should give Beenish Pervez, she may be in the audience. She's the fellow from Stanford working on this, who put this data together for me. Only 3 of those countries scored above a 3 in the JEE. And this is the breakdown that Beenish put together for me on how it looks. And basically what this tells you is that when you look at scores within a JEE, they're really not doing well on biosecurity. And part of that is because the metrics are ambitious, but those ambitious metrics include things like, do you have an inventory of where your dangerous pathogens are housed? I mean, that's a question that countries should be able to answer, and especially given how many countries the US government is assisting to help get those inventories together, this should be a much better assessment than it is. And really importantly, dual use oversight. So for developed countries that are conducting research with pathogens that have pandemic potential, that is not included at all in the JEE. And one of the reasons it's not included is because we don't have a global consensus or metrics about how we would actually look at norms around that issue. We've had a lot of great work in the US in particular on that. Ed has been hugely part of that. I've been involved in it. Many of you have too. Peggy spent a number of years looking at this issue at NTI and elsewhere, but we're not really where we need to be with the global conversation on this. And it's a hard conversation because technology and innovation is vital to being able to fight pandemics, but at the same time, we don't want to see one caused because of misuse. And so it's this conundrum that really makes it a tough conversation, but a worthy conversation. And so just a few quotes to get your creative juices flowing. So Jennifer Doudna, who is one of the first, I can't call her the inventor because I don't think she got the patent for this, but she has been out talking a lot about her creation and use of CRISPR, saying that we may be at the beginning of the end of genetic disease. But she's also, to her great credit, she's been talking about why, as a chemist, she wishes she had had more training in ethics. And she's been talking to students, she's been talking about this tool and how we should be paying attention to the dual use aspects. And so I wanted to give her some credit for thinking about the promise of this technology, but also thinking about how to educate about safety and security associated with it. I mentioned the Bill Gates quote at the very beginning. So these two things juxtaposed really, in my mind, crystallize the issue that we're trying to get at. They're both true. It's absolutely true that we might be at the beginning of the end of genetic disease because of technology. It's also true that we could see a terrorist use or creation of a virus like smallpox at some point in the future. And we know now that horsepox was just created, synthesized by a very capable lab in Canada, which basically tells the rest of the world that making smallpox is possible. It's vital that we address both of these issues for the future of humanity. And both of these things should also be priorities for the academic and innovation community. If we're innovating on ways to fight pandemics using technology, we should be innovating on ways to use that technology safely and securely at the same time. And so I mentioned the US government has done a lot, and we have, and this is sort of a laundry list of things, but I want to draw your attention to the last item on the list, which is the policy guidance on work with pathogens that have pandemic potential, what Jerry Epstein has coined the P3CO policy, which we fought very hard to keep that name because we as nerds really liked it. And so we have a lot of guidance in this country going all the way back to the famous Asilomar conference focused on biosafety in the wake of the discovery of recombinant DNA and use of recombinant DNA technology, through the Fink report, which NTI co-sponsored when Peggy Hamburg was the vice president for biosecurity related issues at NTI. That report recommended an international biosecurity forum, and many things in that report have been implemented, but that one really hasn't. And it's a worthy question, I think, to ask at this point in time, whether we should think a little bit more about that. I mentioned that we don't have a national, or more importantly, a global framework focused on national security risks posed by emerging biotechnology. You could argue the BWC is the framework that underpins everything in this space, and I think that's true, but hasn't traditionally been a forum where very productive conversation amongst scientists and innovators could happen about how we could get to a global discussion on this issue. It's been a great place to have discussions, but not necessarily agreements. And folks can question me on that when we get to the end. That's my personal view. And so the question is, should there be? And if so, how? Should we be thinking about collective risk assessment on a global basis? What would that look like? Should we be putting more money into biosecurity-related innovation? I think the answer to this is yes, but I think this is definitely a question that the academic community, and particularly bioengineering departments, people studying synthetic biology, those who are doing cross-disciplinary studies across health, security, and technology-related disciplines, this is a place where I'd love to see more research and focus. And it's clear that that community, the scientific community, is going to have to lead on this, that this is a place where governments absolutely need to be engaged, and we need to be providing guidance and oversight. But at the end of the day, the scientific community really does need to be leading. And I would also argue that the US scientific community has even more that it could do in this area. And so where do we go from here? What's next? So I'm going to throw out a couple of ideas to sort of get everybody thinking, and then happy to take lots of questions or to have folks question me on whether these are worthy things to consider. But I wonder whether we do need a global group that could be looking at international norms for dual-use research. And if so, who would be in that group? Think a little bit about that. Would it be leaders in the academic community who are the future Nobel laureates? Are those the people that a new scientist coming up in Malaysia or Singapore or China would be listening to? Because this is a field that is growing more rapidly in other parts of the world in funding than it is here. How would those norms actually be adopted? What are the incentive structures for that? Is it possible that we could see a world someday where, in order to be a WHO collaborating center for pandemic influenza, there'd be a specific set of things you'd have to do or be able to show? Is it in the space of dual-use research and oversight? Should we be asking, when we put funding into a new consortium, like GP Wright, for example, which is a new consortium looking at how to create a synthetic cell that's come out of George Church and Jeff Buca, two extraordinarily talented scientists in the US. When you put together a consortium like that, should there be specific norms that have to be adopted and signed on to that are beyond ethical considerations, which are absolutely important, but should we be looking at dual-use oversight specifically? And could the global community ever get to a place where, as technologies are being developed, scientists are thinking about how to mitigate risks as they emerge? And is that the right thing to do? In the cybersecurity world, which is an imperfect parallel, we do have that back and forth of continually looking at what could go wrong and how to patch it. And is that the world we're going to end up in? And do we need to start thinking about that? And my provocative question, could we have a global council? Is this International Biosecurity Forum, is it possible? And where would it be hung up, where would it get credibility from? Is it a UN structure? Is it the BWC, as some have positive? And I'm a little personally skeptical about that, but it is an existing forum. Where would it hang out? It's also absolutely clear that more education and more involvement in the innovation community is critical. And so the synthetic biology community has done a lot on this with help from people like Ed, who've been engaged in the internationally genetically engineered machine competition, the iGEM competition for years, where people are coming to actually create new tools in synthetic biology, but at the same time, they're looking at safety and security. They're having conversations with experts who understand misuse so that they're thinking about how their technology could be misused as they're developing it. That's fantastic. Can we franchise that? Is there more that could be done to franchise that and to fund it? Do we need to be doing more tabletop exercises? This one I'm just going to answer. The answer is always yes, but to ask a question that Rebecca's asked frequently, should we be developing standard modules for this so that we're using the same scenarios and we're actually learning from each other and swapping our experiences globally using the same tools? And is there a way to get that more standardized? And should we have more grand challenges in biosecurity innovation? DARPA's been leading in this space for years. Do we need to do more of this, where we look at not just the creation of new tools, but if they're misused, how do we counter them? Do we need more safe genes-like efforts, which is a DARPA program looking at how to counter genetic modification if it were to get out of control? And then the key question, and I think the answer to this one is also yes, biosecurity has to also accelerate innovation. Can we use the biosecurity community to help develop even better tools to counter pandemics, but to do so thinking about risk while we're doing it? And then I mentioned this earlier, are there ways to actually incentivize codes of conduct, using funding pools for innovation that you'd have access to if you adopted norms, could we be looking at carrots here and not just sticks? And so I mentioned a couple of these ideas as potential ways ahead. Do we need to really make a concerted effort in the next couple of years? I think the answer is yes. I think that while we've been on a continual track where we've had technology advances and inflection points for the last decade plus, I do think that we are at a period of time right now where there is a lot of interest in building the bioeconomy, and that's really important. And I think we have an opportunity to build in to the bioeconomy really great best practices in biosecurity and biosafety. And I'm really worried that if we don't do it, the time will pass us by and we will have missed a huge opportunity. And I'm really looking forward to hearing some of your thoughts and ideas on this and to talking with many of you more about this as we continue to think about it at NTI, but also in the community. And so there's a lot of hard questions that still remain in this space. These are just a couple of them. For what strategies could we actually be building in biosecurity? If we had modified, if somebody were to be able to create smallpox and modify it, who would counter that? How are we going to get to the countermeasures that we need? CEPI is a great start, but we need to also be thinking about that world and how to get to medical countermeasures on demand in a much more efficient way than we've been able to. And there's a lot of people thinking about that, but we're not there. If the world where we have medical countermeasures for everything is here, and we're here thinking about biorisk, there's a huge period of time in the middle where I think we need to be focusing some more attention. Let's see. Nope. And so just to summarize two topics that hang together a little bit with the ultimate goal of stopping outbreaks at the source and preventing them in some cases before they begin. We need to continue to lead as the United States, but we also need to be able to leverage what we're doing globally more effectively. We need sustained investments. I mentioned earlier that the ability to measure outcomes is vital. And then accountability. I do think accountability for achieving results is going to be critical to keeping people engaged in the whole global health security effort going forward. Thanks. 5 minutes. We have time for a couple questions. I didn't leave as much as I had hoped because I keep looking at that clock and thinking it's my fault. Josh.
Yes, thanks. That's a great talk.
Thanks for coming.
My question involves the overlap between the GHSA and the biosecurity. So you said you would ought to keep the biosecurity goal in the GHSA, but then you went on to talk about a whole set of other issues related to biosecurity.
Mm-hmm.
So what are the limits of what the GHSA can be used as a frame to address these issues that you raised? And where you talk about a global forum that would be outside the GHSA, I assume. And so
how do they fit?
How do they fit together? And so what can the GHSA do and what can we do outside the GHSA?
Yeah, so that's a really great question. So I think the answer to the question, so when I was talking about the international, like having a forum or a council of innovators, I do think that if it turns out to be a worthy goal to have that group exist, I think it should exist in its own rights and be able to be, literally the people who are at the top of their game from the countries in the world building these technologies, who, if they publish a set of norms, the world will pay attention to it. And that doesn't mean it can't fit into the GHSA, but I was talking about that as a separate thing. In terms of how this fits with GHSA, though, in the joint external evaluations, we have the opportunity, if we had metrics for how countries were doing with dual-use oversight, if we could agree on some indicators to add to what's in the JEE, it would absolutely be a great place to assess countries. And I think what it would show is that the developed countries have some work to do on biosecurity too. Many developed countries like the US have done a lot on inventorying our dangerous pathogens and looking at how to, in a very list-based way, how to control access to very specific bugs. But many countries have not really addressed at all what to do about the ability to modify pathogens across the board, so looking at a more risk-based approach to biosecurity. As one project that we're working on with the Johns Hopkins Center for Health Security and the Economist Intelligence Unit, we're looking at a global health security index, and one of the areas where we are working to add some indicators in the pilot project is in this space. So how can we actually address whether a country, using publicly available data, has put in place some oversight for dual-use research? And so that's a start. But I think if we had indicators and could build it in, it would fit in as a piece of that. And it's one of the reasons we wanted to have biosecurity in there, because over time you can add to it. Does that make sense? Julie.
Thanks, Beth. One of the topics that you brought up in both the GHSA work and in the biosecurity is the question of sharing more best practices.
Yeah.
This is something in the JEE reports. We're capturing snapshots of where countries are, but not necessarily documenting best practices or what's reproducible, what's, as you said, franchisable, that could be shared with others for adaptation. And it's a place where we're still lacking a clearinghouse. In your new position, with what you've seen here, for both your biosecurity and your GHSA paradigm, what are the next steps in actually trying to capture and document some of those practices that have been effective and to share them globally so that stakeholders and SMEs everywhere can start thinking about how to adapt and apply them?
Yeah, so I think you should do that. But I think more importantly, there was a lot of thinking on that when the action packages were put in place. And so the action packages were originally created to get to agreement on targets, but also to create some communities of practice. And some of them have been really effective, and effective because the communities work together, like AMR. That community is essentially the same community working on AMR in the WHO context, and this was one more mechanism for them to leverage their work. How are they assisting other countries to improve AMR? The Biosecurity Action Package is moderately successful in that it exists. It's had a secretariat. It now has NGO involvement for any of you who are interested. But what it has not been successful at, any of the action packages, is really in a much more streamlined fashion, sharing best practices and having sort of that important piece, which is how did you tangibly show that this best practice is one that you should adopt, or it worked in the East African context and we think it's adaptable here. I think that, so when I was talking about sort of global biosecurity dialogue, if you look at the whole GHSA spectrum and you think about each one of those elements, and if you wanted to actually work with wherever you sit in whichever part of GHSA you focus on or you're interested in, how would you sit down with a group of countries and walk through the assessments as they exist, and then look at how you would actually build? My hypothesis is that if you took some countries that had best practices and you took countries that had been assessed and you put them in a room together and were really structured about it, you could actually get to a place where you could be publishing some specific best practices that worked and then follow them over time. And I think that we need to do a lot more work in that, because I think if we can show that not only are the metrics that we have solid, and some of the metrics I think are good in the JE, and some of them, we've talked about this, some of them are squishy, right? And we knew that going in. But if you can get to a place where the metrics are solid and you know what best practices actually help improve the metrics, then you're really talking about leveraging dollars much more effectively, right? So I think it's a great question, and we should do more of it, but I don't know exactly how. In all seriousness, though, I do think that in GHSA 2.0, having targeted conversations around each of those areas, or at least a subset of those areas, would be really helpful. We're looking at whether a biosecurity-focused dialogue for those pieces of the JEE would be something that we could support.
Just to follow on that, is there room within GHSA for countries to actually report, because having worked within it, what did not work, and the failures, so that those can be communicated, because that doesn't seem to be the way that anybody wants to practice.
So that is an excellent point. Within the community that's looking at the joint external evaluations, there has been discussion about what works and what doesn't work. But I do think that we should be building that into the specific target discussions that are had in the next 5 years, because I think that as I said with Julie, some of the targets have been more effective than others. And while we really didn't want to change the targets within the first 2 or 3 years so that we could get to a place where we could actually show what works and what doesn't, I think without saying what doesn't work, we're not going to get to a place where we have the connection between the best practices that actually improve outcomes. So yes, I think that needs to be more of a focus. It has been a focus of quiet discussions, but not publicly facing discussions. Yep, we're over. Thank you.
I know a lot of people came here on their way to work, so we don't want to keep too long. But I wanted to take this opportunity to thank Beth. Thank you for an interesting presentation with some questions we need to think about. And I also want to thank all of you for coming this morning.
Thank you.
And for joining us here. And for what we hope will be a kind of a new menu for a new forum for having some of these discussions. These are conversations that used to happen on a pretty regular basis in the community, and that's kind of slowed down. And I think our center here, as well as a couple of other groups across town, are trying to revitalize that. So we look forward to ongoing discussions. So with that, please join me in thanking Dr. Cameron.
Thank you. Thanks for coming.